So the majority of my primary total joint practice is done in an outpatient setting today. The biggest thing is we know that patients just really like it. Who wouldn't want to go sleep in their own bed at night? The two biggest things that we're so much better at now than we used to be 20 years ago when you had a 3 to 5 day hospital stay is we're better at blood loss management and we're better at pain control. So ideally, a patient comes in the morning, they have their total joint surgery done, they're walking about an hour afterwards in recovery, and then they're home for lunch. You're getting better sleep at night because you're in your own bed. You're up and mobilizing way more just because you have to fend for yourself a little bit. And then you can go to outpatient therapy. And so we've really made a lot of strides in terms of not only improving the patient experience, but also the safety of outpatient total joint surgery. Hip replacement today is the most successful surgery we do in medicine. It's got about a 98% success rate in terms of excellent improvement of pain and function. Ultimately, patients feel like their hip replacement typically is a normal joint. They don't really notice it was replaced once they get done with recovery. And so in reality, what we've been working on is how do we speed the recovery and how do we make recovery easier? And what I've settled on is a superior approach, or basically a minimally invasive way to do hip replacement. There are ultimately about 7 different ways to do hip replacement in terms of approach, and that's what I often discuss the most with patients. The good news is I've done every single one of them, and if there's really 7 different ways to do it, there's probably not one that's ultimately better than the other. There are just pros and cons. At the end of the day, regardless of the approach that you pick, you just need a surgeon that does a lot of those and that you have trust in. The majority of patients that undergo hip replacement today can be done on an outpatient basis. Typically they're walking the day of surgery and they're home sleeping in their own bed at night. I tell patients that you can expect to be pretty close to normal by about 6 to 8 weeks, and ultimately by 6 months feeling like you've got a natural hip joint again.